Hello. Sometimes you hear about medications being overused in psychiatry, especially conditions like ADHD or depression. Since there are so many advances in medicine, you may wonder if there are tools that can help us make more accurate diagnosis or match treatment so people don't have to try one medication after another and we can find the right fit. Well, there are. And today we are going to talk about one of those tools called QEEG Brain Mapping. And our guest today is going to share about this wonderful tool and how it can help personalize diagnosis and treatment of mental illness. So if you're interested, stay with us. Welcome to Happy and Healthy Mind program, episode 137. This episode is sponsored by shifahealth.org, dedicated to optimizing mental health and well-being. And I'm your host, Dr. Rozina Lakhani. Over the last 26 years, I've been helping people function at their highest potential without ADHD, anxiety, or depression or burnout blocking their way. I'm an integrative MD psychiatrist, a best-selling author, speaker, and a university professor. This program is for educational purposes only, so please consult your healthcare professional for any medical advice. And today, our guest is Dr. Steve Rondeau. He's a naturopathic doctor specializing in developmental pediatrics. He's now the president of Axon EEG Solutions, an EEG interpretation and research solution company. And he also serves as the guest editor for the Journal of Personalized Medicine. He's published several articles on the utility of EEG in psychiatric practice and resides in Fort Collins, Colorado. I'm so grateful for Dr. Steve. Thank you so much for joining us today.
You bet, Dr. Rozina. I'm glad to be here.
All right, so let's jump in. So, Dr. Steve, tell me, how did this topic of, QEG became important in your life?
It goes back about probably 20 years, but I think I'd had interest always in sort of technology in medicine. I liked data. I always liked data. When I was doing my work with pediatrics, a lot of what we were doing was in data points and biomarkers, particularly in autism. I think it just sort of naturally lended itself to that, that sort of application. When we started our first integrative mental health clinic in 2009, QEG was really sort of a backbone to it that allowed all the different providers to almost kind of speak the same language. So we had therapists, psychiatrists, medical providers, all different types of providers. But the one thing that could bring us together was to have some objective data as to what was going on with the patients. And I think that the EEG really did a good job of that, so we could all kind of speak the same language.
You were telling me earlier how it started helping when you were working for a substance abuse treatment program. So I think that was fascinating. Please share with our audience, how did it started helping in that area?
Yeah, it's one of those stories, we were talking about before that I think you have certain patients that just sort of stick with you. And I think that was not only the patient, but the sort of just the whole instance. And so we were working in substance use center. It's 18 to 25-year-olds. And it was, I don't know, it was probably 2014 or 15, maybe sooner. I don't know exactly. But we had a girl there, and I was going over their EEGs and in those centers, and I'm sure you've probably experienced this, like the paper trails aren't always the best. You get these people from all over, different states, countries, and different docs and charting. And, this was before EHRs were really everywhere. And so we didn't really have much information on this girl. And I remember sitting down with her, and I looked at her brain scan, and at that time it was just sort of peripherally to what I was doing. It was just kind of like it was something to sort of break up the week that I would do. And I would go down there and do brain scans, and we would do different treatments, based on that. But anyways, I look at her EEG. I said, "This looks like you have ADHD. Like, why are you here? Because this doesn't look like any of the other people that we usually see in this facility." And we were seeing a lot of alcohol, some opiates, and a lot of cannabis at the time before it was legalized here. But I said, "This looks like you have ADHD. Why are you here?" She says, "Well, I don't have ADHD. I have panic attacks. And I can't leave the house. I've been in 3 different treatment facilities, and you you might know this, but those treatment facilities aren't cheap. So she's not probably there just to hang out and have a good time. And so I said, well, why don't we just treat you as if you have ADHD? Because that's what your scan looks like. And you've tried every anxiety medication. Like what else are we gonna do? She'd probably been on 40 meds at that point. So I connected with their psychiatrist. I said, why don't we just treat her as if she has ADHD and we'll give her, like a stimulant type of medication. And they agreed. And we talked about the risk and so forth. And we did that. And that's when all of her panic attacks went away. And it was kind of one of those moments where the psychiatrist and I sat down and we're just like, in a regular setting, like you would never think to do this. You never think to do it. But instead of just going based off the symptoms, we went based off of her objective data, which still to this day is pretty novel within mental health to have a test of the brain. So anyways, that's really what transformed it. And I think that, and there's a couple other key moments, particularly around suicide, that really made me jump into this head first and really take it on. So yeah, I'll never forget that case. And it was really interesting to see how quickly someone can turn around when the treatment is personalized or individualized for their particular brain pattern.
That's wonderful, wonderful. Yeah, so for our audience who may not know what brain mapping is, what QEEG, can you kind of share in kind of layman language
Yeah,
what this objective tool is that we're
yeah.
talking about?
It's funny like to word it that way, because the more you do this stuff, the more sort of like disconnected you get from the beginning, which was kind of understanding what QEG is. And QEG was set up years ago, like probably I think it was like the 70s, as a shortcut to having to read raw EEG, like regular EEG signal, the tracings with all the squiggly lines like you might see on some record. Perhaps someone have had seizures or something like
Like,
that.
most of the people who may have kind of seen those
Yeah,
squiggly line is like when somebody is checking their heart, the
right.
EKG. So what
Yeah.
is the difference between an EKG and an EEG?
Yeah, that's exactly what I was sort of hesitating on, because I was picturing an EKG as I said that. It just measures the electrical activity of the surface of the scalp. And so based on that, they take the surface readings and we transform it into all this digital data. Okay, instead of the squiggly lines that you'd have to thumb through pages to look at, we can turn it into numbers, and those numbers become massive Excel spreadsheets, and then the spreadsheets then turn into these really detailed pictures that we can look at in now into 3D type of models. We can look at different brain networks and all sorts of things. But the idea is to take something that's really sort of rather ambiguous and hard to make sense of, and really is used mostly just to look for seizures, and then transform it into something that's more meaningful for the psychiatric providers like yourself, who can use the images to then translate to some understanding objectively as to what's going on with the person.
Right, yeah. And when I'm explaining to my patients, that's what I'm saying. Like, we check the electric activity of heart
Yes.
through an EKG. We check
Yep.
the electric activity of the brain through EEG. In
Yep.
past, it used to be used for picking up the seizure disorder. And now with these advanced technology, we are able to use it for diagnosis and treatment matching for mental health disorders. And
Yep.
so that's how we are using in our clinic also. And it's been a wonderful experience because I actually had a similar case, not a child, but a woman in like her late 40s. She's been depressed for a long time. And when I did the QEEG for her ADHD marker was like really high. And
Mhm.
then she said, well, I've never been diagnosed with ADHD, but my son has ADHD. And
Mm.
there's like, so there's these all indications. And I said, okay, let's just we're going to treat the depression, but let's kind of add this component of treating this aspect so we can get better results. And so
Yeah.
I'm picking those ADHDs, but at the same time, I'm also picking the cases where a stimulant is not right, even
Yeah.
though they may have ADHD type of presentation,
Mhm.
but a stimulant treatment is not going to work in those situations. And in those cases, I'm able to avoid overusing stimulants because
Yeah.
it's not likely to be beneficial. So it
And
has
that's a
been really
that's a
great.
key thing too, Dr. Zina. That was a key thing is understanding that. In fact, we just presented in Arizona on a case of a boy, a teenager, and he was diagnosed with ADHD tried every stimulant under the book, or, in the book. And when we matched his profile, he actually matched to a mood stabilizer. The mood stabilizer transformed this kid's life. I mean, he went from learning disorders to a boarding school. This kid was in a boarding school for his symptoms. I mean, that's how bad he was. His parents would send him away all year to go to this specialized school across the country. And when we met up with him after, picking the medications that actually helped his, treated his brain patterns, it was really just so transformative to see this kid turn around. And it has such a ripple effect from just not only the school performance, which is, pretty important at 15 years old, but also just like self-esteem and, the interaction with his parents, and just so many things, just even having time after school to be a kid because he's not doing hours and hours of homework anymore. So it has a lot of implications, much further than just beyond, narrowing down your meds. I think it really has a big effect all the way around.
Yeah, yeah. Definitely, I'm seeing that in my situation, or as I'm applying it for my clients in our clinic. But the fascinating thing is finding the patterns, which is almost like my patients are telling me that it's so much validating. Like I had a
Mhm.
patient whom I was treating for depression, and she came for TMS. Yet when I did the scan for her and explained, like what her markers was, the story that her markers, brain markers, was telling, she had almost tears in her eyes. She
Mhm.
said, this is so validating and
Mhm.
empowering, because I have been feeling that I'm just not trying hard enough
Mhm.
all these years, and just seeing that it's my brain pattern that is making it so hard. i
Yeah.
feel I feel empowered, I feel validated. And that's what a lot of people are telling me, that when they find this scan, because many times in mental health, all we have to go by what people are saying to us subjectively. And so the people who don't understand think that these people are manipulating, they're just making it up, they're just not
Right.
trying hard enough.
Right.
And having a objective tool to show that yes, this is their brain pattern is very validating and comforting and empowering.
Can I tell you another quick story?
Sure, sure, love
So
story.
we had a guy one time, and this was probably around the same time because I was working closely with the same psychiatrist at the time. And he came into the office and he was talking about how anxious he was. Yet when he was in the office, he was sort of slouched down in the chair, almost looked like he could fall asleep. And it was one of those moments where, was working in residential addiction. So I'm thinking like, okay, is this person just like looking for drugs? Are they, going to sell it? Or what are they going to do? And and so it was really interesting to hear him talk about how anxious he was. And so I went back to the psychiatrist and I said, do you think he's just like drug seeking? Like, what is going on? So well, why don't we do a scan and see? And again, this wasn't routine at the time. We were doing this. I mean, we did a couple a month. I mean, this wasn't, and now we're doing, that particular clinic probably does, dozens a day. And so at that time, we're hardly doing any. So I go back and I said, let's do a scan and let's see what's going on. And it was at that moment, and I don't know if I've ever told you the story, but it was at that moment when we realized that there's a subgroup of people who are anxious, whose brains are going too fast. Okay. We refer to them as sort of being over aroused. And that's kind of like your classic anxiety. But in this individual, their brain was actually going too slow and they were overwhelmed. And that's when we started to really understand, through the data that there's a whole subgroup of people who talk about being anxious, but it's not because their brains are going too fast. It's because it's going too slow. And we need to, sort of speed those people up. And it was probably around the same time as the girl with the panic attacks, because we were just starting to like understand that, hey, there's this whole different demographic. And, you do one thing to help the one group and it's going to make, the other one worse. And so without that data, we would have never known. And I think it goes back to, like you were saying, the validation. It just really, would be easy to kind of write them off and say, I don't really think you're anxious. Let's do something else. But, no, we see it. And we see that, a person actually had trouble processing information. And that's why they were anxious, was because they were overwhelmed, not because their brains were going too fast.
Yeah.
So it's really interesting. I think I could think of a million stories like that, and particularly I think a lot of the people that come in to see you as well have tried a lot of other things.
I want to kind of share for our audience who have never seen and how the report comes out. I want to share an example report, kind of give them some idea. Of course, it would be different for everybody. And so this is an example of how the report comes out, where we get certain ratios between different types of brain waves. So we get these great pictures, but it doesn't make sense until
Yeah.
we understand that these pictures represent relationship of different brain waves in different parts of the brain. And so then we get these ratios, and based on these ratios, we can make a determination if the person is struggling with ADHD type of problems, depression, anxiety, overwhelm. And it also tells us if the person may be treatment resistant to certain kind of medication and using other type of interventions, or which medication they were likely to benefit. And my favorite part is this section where I can see what appropriate medication the person is going to respond to. And many times I find that I have tried these medications and maybe not tried in combination, or not tried these medications. So I have the option of offering the patients. And so it kind of opens the door to having more matched medication, like medications that are likely to respond to this kind of brain pattern. But another aspect of this report, especially the one that Axon does the interpretation, not all QEG company does it, but Axon also does it, is giving me some recommendation for natural nutritional supplementation. And so can you share how we can utilize the natural nutritional supplements or the restorative daily practices to help our clients do better based on their brain pattern?
Yeah, you brought up a couple good points, and I think the first one to kind of hit on is that not all QEG is the same. You can get images, but how we translate it is really comes down to how the data is processed and how it's handled within our data set, so that we can look and see how people have responded and continue to teach the system to learn. So we say, okay, these types of brains respond to these types of treatments. And we can do the same thing when it doesn't matter what the treatment is. It could be psychiatric medications, which of course have the most published evidence, but it can be things such as different types of psychedelic treatments, or even different types of therapies like TMS and some of these other sort of neuro stimulation therapies. So to specifically answer your question about the supplementation, it was part of our early research, and we've done this now with a number of companies, but we've taken products that, and I bet you've experienced this even just as a consumer. You'll go down this, at the natural health store, or, one of the, stores that sells over-the-counter formulas, and you'll see these formulas for, say, anxiety, but you look at the back of the bottle, and some of them, are like, you don't even understand how that could even work, and I think as a consumer, if you don't even, you don't have the background in natural medicine or any of that, how would you ever know which one to pick? And so that was always my sort of gripe when it came to, doing mental health treatment. So how do you pick it? So anyways, we were working with a couple different these natural supplement companies, and one of them, this company that does really rigorous testing, and we said, hey, why don't you send us some product and we'll, test it and see if it can do what it says it's going to do, or if it can replicate or replace some of the medications. And so we spent a couple of years doing that, testing anyone who, we could, and doing these pre and post scans to see how it affected the EEG. And in the process, we learned a lot. We were first going after, kind of like the depression formulas, some of the anxiety formulas and so forth. But we learned quickly that there's some patterns that respond to treatments that even medications weren't effective for. So it was really a really kind of interesting time of studying how these things affect the brain, and not all of them do, as you can probably imagine. Some of them, say, hey, this is for anxiety, but it really doesn't have a whole lot of effect on their brain. Doesn't mean it couldn't be helpful, but it doesn't affect the brain. So yeah, that's what we did. We spent a lot of time doing that, and came up with these different formulas, and we still continue to do that. That's there's a lot of that work going on in the background. I don't even think I've talked to you about yet.
So work in progress, but still it gives us the starting point. And then how did you come up with these restorative daily
uh,
practices that we recommend? Because I've been finding it really helpful. A lot of people like, they say, okay, well, ADHD, do the meditation. They say, I can't do meditation. My mind is too fast. I can't sit
yeah,
down. And so
yeah,
giving them these specific, either like short term or type of meditation that would work in their
right.
brain pattern is really helpful. But like, how do you come up with them, and how do you tell which person to recommend which type of daily practices?
Yeah, it's such a great question. And it goes back again to the addiction center in some of our early work. And we were so fortunate, I look at some times of your life like that for me was quite stressful. I had young kids. I was commuting twice a week, like hundreds of miles. But in the end, we had learned so much information. And one of the things we learned, and I was the first to sort of raise my hand about this, was that not every meditation is good for everybody. And so they were routinely recommending this one type of meditation to everyone. And knowing what I had known about EEG at the time, I said, some of these folks with the depression patterns, that might not be a good fit for them. And it was almost like they sucked the air out of the room because it just got so quiet. And they're like, what do you mean? Meditation is good for everyone. And I was like, yeah, it is, but there's different types. And so I sort of backed off a little bit and I didn't, make a big stink about it. And then about 2 years later, there was a gentleman, a doctor, I think he was out of Northern Washington. I should connect you guys actually. He wrote a book on what he called neuromeditation. And in his book, he says exactly that. Not every meditation is good for everybody. And we're going to base this off the brain patterns. And so I was, jumping up and down like, hey, here it is, here it is. And it's all referenced and cited and so forth. And so that's how it kind of got started. And so we started thinking about these things and this is really key, is that you can have abnormal brain patterns, but if we have good compensatory mechanisms to help us, we can thrive. And I think that section of the test is my favorite because it shows people, it gives them a roadmap that if you do these things, you can create an environment that supports your brain patterns, and that's what it's really all about. And I think a lot of us, to some degree, it's intuitive. Like we understand, like I need to go for a couple long distance bike rides a week. Like I know that's me, and that's time for me to just sort of process, download everything from the week and process, be alone and just, think. And so other people, they have different types of outlets. And so anywhere from recreational outlets, like hobbies and interests to the meditations, to journaling strategies. And generally speaking, those things are probably generally good for everybody, but how do you know? How do you know if that's going to be the thing that does it for you? And so that's what we had to do after that, is we said, well, we kind of think this is good for this type of person. We kind of think this is good for this type of person. And we had worked with a number of therapists to develop this. And then we had to go through the sort of arduous task of citing all of those things and referencing them all, because not everything had references, but it really created, a nice time of finding references around these things and learning new things, like, how rates of depression are decreased for people who volunteer more, and it's like, who would have ever thought that, that volunteering is going to be, good for your depression patterns, and that and so forth. So anyways, I guess my point is that if you can do those things, you can curate an environment that can be very supportive of your brain patterns, and see where you can really thrive. And I think that helps people understand that, we all have these deviations, and that it's not that we're broken, it's that we're not in the environment that really is suiting our strengths, at the moment, if we're coming in with symptoms.
Yeah, that's wonderful, wonderful. So we are talking about all the benefits of having this kind of testing done. Can somebody get a diagnosis if they don't have the previously diagnosis of, let's say, ADHD or something like that?
Yeah, so in the context of EEG, I mean, it's usually used diagnostically for things such as growth pathology, such as like tumors, masses, and so forth, and epilepsy. And those are usually done with either a neurologist or an epileptologist. Okay. When it comes to the quantification, it's a field that it doesn't necessarily have the clear boundaries in terms of who can make those diagnoses and how we can use those tools. And I think that there's still some work to be done in the field to kind of tie together what what we consider sort of normal and abnormal and so forth. And as a result, it lends itself more to the idea of finding trends and tendencies, such as I have impulsive trends, or I have more emotional lability trends, or things like that, as opposed to specific diagnosis. But that's from the technical standpoint of like what, the FDA says we can say about the test. When it comes to actually, using it on a day-to-day basis, you can find it to be an invaluable tool to help you in the aid of the diagnosis, which is kind of the way the wording is, can aid in the diagnosis. And I think the classic example that we see, pretty often is to have, a young school age kid, maybe late elementary, early middle school, and someone suggests that maybe they have attention deficits, and I don't know if I want to start on meds just to find that out. Let's do a scan and see if that's what's happening. And so that's the kind of, transition that we would see. We would look at the EEG and then decide, does this person look like they have tendencies that are consistent with individuals with ADHD symptoms? And if so, great, let's figure out what sort of treatments might be efficacious to help them, through school or whatever. So
Mhm. But isn't like, one of, there are different biomarkers, and I understand this is kind of a science in progress, but one of the biomarkers for ADHD is pretty well established in research, right?
yeah. Yeah, I think the challenge, and I didn't want to unpack a huge can of worms, but the challenge comes back to the DSM, and we should talk about this sometime, because the DSM is based, off of people's subjective interpretation of their symptoms. But one of the things that really seems to be becoming more apparent is how the heterogeneity of these conditions. Like, for example, if you were to take, say, 100 people with depression and do an EEG on them and only study one biomarker and say, we're only going to look at left frontal asymmetry, which is a sort of common biomarker that we talk about in the field. You may find that to be the case in, let's say, 30% of your sample. You say 30% of your sample has left frontal asymmetry. And you say, well, that's not really much, that's not very helpful. It's only there in 30%. So this tool doesn't work. Well, the argument I would make is that the diagnostic criteria within the DSM is where the fault is that it doesn't differentiate between we'll say a depression caused by left frontal asymmetry or right posterior asymmetry. But as we talk, of course, now you can distinguish those from, in your clinical practice, but the DSM doesn't do that. And so as a result, you end up with a really sort of mixed bag of patterns that could potentially be, manifesting as depression. And what one might call a shortcoming to the actual test actually becomes apparent that it's quite a gift, because then it tells you as a provider, what flavor of depression does that person in front of you actually have? Because then you can pick, and that's the most important part, you can pick the right treatment for them. So that's
Yeah, it
really, I
has
think,
been very,
the
yeah,
point.
it has been very helpful in that way. But I kind of feel like general public, this may be too clinical
Yeah,
information, but like in summary, there are different types of depression or different
yeah,
types of anxiety, and there's a lot of overlap. Having known the brain pattern helps us providers to choose the right treatment strategy that is likely to benefit in this in particular
right.
situation. Talking about all these benefits, are there limitations? And we talked about one of the limitations, but are there kind of other limitations that people should be aware of?
Yeah, I mean, I think that there certainly is. Some of the conditions, I think if we just talk about it from the results standpoint, I mean, you can have conditions that are caused by other things that may show up as psychiatric conditions, and that's not going to necessarily pick that up. Like perhaps you're depressed because of, a problem with your thyroid, or maybe you're depressed because, there was some trauma, early in your life, or you're going through divorce. That those types of things are going to be a little bit trickier to pick up, the sort of circumstantial things. So I think on the surface, that's probably one of one of the challenges. I think the other is accessibility. And so having access to that, and that's what, we're trying to change. I mean, I would love to see this be a universally applied tool to anyone that comes in, not only with a psychiatric diagnosis, but even just like a school sports physical, just so we can understand, hey, if we have a head injury, what changed, that kind of
Yeah,
stuff. So
yeah.
I think the accessibility, and then probably last but not least would be, third-party payment. And until we get that universal third-party payment coverage, I think the accessibility is going to continue to be one of the limiting factors. And, in the meantime, all we can do is continue to publish and promote, the utility until we can get, the sort of slow moving train to catch up,
When you say third-party coverage, you mean insurance coverage?
Insurance, yeah,
And
insurance
then
coverage.
accessibility wise, that's why we are on the pioneer. We are one of the few people who are doing the QEG in this area. People say, okay, well, does it require a prescription? I think it does require, because it is just a tool, one of the tools, one of the many tools that we use for diagnostics. So it has to be used as part of the overall clinical picture. And then what to expect. So many people say, okay, well, if I schedule, would it do something to my brain? Would it change anything in my brain?
Yeah.
And so that is a usual fear. So what would you tell those people?
Yeah, I think that's an interesting one that you bring up because looking back, it's hard to remember the first time I had mine done, but you don't know, and I think sometimes these thoughts go through your head like, well, what if they could tell what I'm thinking, or what if they think I'm faking, or all these different things. And so no, it's not like that. It's a very, very passive process. You sit there with either a cap or some sort of hardware on
So
your
I'm just kind of showing a
yeah.
picture of the helmet that we use
Yeah.
in our office. So it's just kind of a simple helmet that is put on your head. Yeah, it's kind of 6 minutes eyes closed and 6 minutes eyes open type of
Yep.
scan that we measure, and then we send them to you. And then
Yep.
you do your magic,
Yep.
come up
Yep.
with that interpretation.
Yeah. We process the data. We have to clean it up because there'll be, eye blinks and movements and so forth that we have to eliminate from it. We have to account for any medication someone might have been on, and, perhaps they had caffeine that morning, that sort of thing. But really it's a pretty easy passive process, and it just requires you to kind of be there and sit still, which I say is easy, but if you have a kid who's struggling with attention, sometimes sitting still with your eyes closed for 5 minutes can be a quite difficult
Challenge.
task. Yeah, yeah,
Yeah,
yeah.
yeah. And yeah, so like I tell my patients that nothing is going in your head.
Mhm.
There's no changes happening. It's just measuring. It's just
Yeah,
kind of like you do the EKG, you just measure. We are just measuring, and so nothing is changing.
yeah, or like a heart rate monitor. I think a lot of people have done that. It's the same sort of thing. It just picks up these minuscule little electrical this current, and then it amplifies it, and so it's something that we can read. So it doesn't, yeah, you don't feel anything.
Wonderful. Wonderful. So we've been talking a lot and I learned a lot. I'm sure our audience may have learned a lot. My favorite story was of this girl who had panic attacks and got cured when we addressed her issue, which was her attention deficit issues. So that's wonderful. Let me ask the audience, what did you learn? Do you have any questions that we can answer? Please reach out to us through our website, shifahealth.org, which is SHIFAHEALTH.org. We have this tool available in both our offices in Silver Lake, Everett, and Mount Vernon, but we are in Washington. If you are outside the area, reach out to your local providers to see if this tool can be offered to you. If you love this program, show it by liking and subscribing. If you benefited from program, guess what? Others will too. We all like to help other people and make a difference. So all you have to do is click the share button and help others also benefit. Before I end, do you have any last message for our audience, Dr. Rondeau?
I think that thinking about these things and your mental health issues as gifts and not challenges is a big thing for me right now. And I think that, if you're struggling with mental health, we need to think, a lot about what environment, what was a time when we were doing well, because likely our brain patterns were pretty similar. So how can we get back to that place? And I don't think too that, the medicine can be a short-term, help for us, but I think long-term, we want to look at that, that the environment and how much of a role, that is playing too. So, yeah, but again, without the objective data, it makes it, really difficult to sort of guess what's going on. So, Yeah, I'm thankful for you and your support too as well. And utilizing our services and of course I love talking to you about this stuff. So anytime we want to talk again, especially more cases, it's super fun.
Yeah. So let me ask the audience, if you have any questions, we have open invitation, option to bring Dr. Steve back and ask those questions. So please send those questions and let me kind of wrap up. Every day is a new day, new opportunities. So whatever happened till yesterday, that's past, can't do anything, but you can learn from it. Future is like mystery, you don't know, but you can plan for it. Today is the only day when you can make a difference. So try to take one step to empower yourself, make those lifestyle recommendations, changes in your life to live 1% better. And that 1% would make you better and better every day. On that note, stay safe, happy, and healthy. Until next time, Dr. Rozina.